Welcome Internet. Today we're talking about the fantasies involved in taking mental health medication. Before we begin this video proper, I need to basically be very clear. I am not a psychiatrist. I am not a medical doctor. There is no prescription involved with psychologists in France. And even though I had some courses on pharmacology, I am by no means an expert. And I'm not going to be talking about the medical biological objective side of things here. This video is solely, and this is very important, solely going to be about the fantasy, i.e. the subjective construct, the fears, the hopes, the ideas, the beliefs, the expectations of the medication, not the real effect. And this is important, right? And I don't want you to misconstrue this as medical advice, because it isn't. This is purely about subjectivity. Now that I've gotten this out of the way, there are, interestingly enough, a lot of mental fantasies involved in taking medication. And these fantasies are very wide-ranging. Here I'm going to talk about those that I have seen as a psychologist, referring to a psychiatrist, or even when patients saw a psychiatrist and then were talking about what they expected from the medication. One of the main fantasies, the first one I'm going to start with, is the whole change. That patients might have the construct or the hope that the medication that they're going to take is going to cure them of all the ailments that they have. That in a way their subjectivity is going to be fixed by the medication, that the medication is going to make them whole again. This wholeness is something that we can see in the fact that they feel that they can go back to who they were before, for example, the depressive episode, before the anxiety, that they're going to be cured of their ailments, that they might even be able to go back to who they were. Here it's very interesting because basically what I feel that the patients are expecting of the medication is a form of deep transformation, deep inherent phenomenological, i.e. subjective transformation, that their being is going to be transformed by the medication. And this, I think, sends us back, if we were to use psychoanalysis, to Christopher Ball's theory of the transformative object. So for those of you who don't know what that is, it's very simply the fact that in the very early days of life, that the caregiver transforms the subjective experience of the baby, because the baby is in pain or suffering or frustrated, and the presence of the caregiver and what they give to the baby, for example, let's say taking care of them, feeding them, and so on and so forth, is going to transform how baby is. And it's going to be compounded also by the fact that the caregiver just needs to take the baby outside of the home or even in another room to literally change the scenery of what baby is seeing and experiencing. Therefore, this transformational aspect stays very potent in the unconscious mind. And that potency is something that's going to be experienced throughout the whole life of the individual. And namely, when they're going to take medication, that medication is going to cure them back to where they were. In a way, that medication is a substitute for the feeding of the caregiver to the child, that they're going to give them the good sins, the sins that are going to go inside of them and fix whatever is broken. And I think that the medication works like that. It works on an unconscious level as the good elements of the external world, of the caring parents that are coming within, that are transforming the bad sins within, that they're containing and basically breaking down all of what is wrong within. And of course, I need to stretch this, that it's not necessarily something that the patient 100% believes, but it's the hope, the expectation, once I get under medication, everything will be better. Once I get through medication, my life will be easier. Once I get medication, I won't be basically needing therapy because I'm going to be okay. And this is often a misunderstanding on how medication works, because medication helps in certain cases, of course, but it doesn't do everything. It doesn't transform subjectivity. But that's how the fantasy goes, of the transformation, of the now everything's going to be okay kind of hope. So this is for one fantasy. But there's another fantasy that's as interesting, that some people, for example, might feel that if they were to take medication, then they would be weak. That they can't take medication because medication is the easy way out. So here it's very interesting to see that these people do not wish to rely on the medication because there's this fear that the medication would somehow make them weaker or will be a form of recognition of an inner weakness. Therefore, it's not something that they want to engage with. Also, there might be the unconscious fear that the medication in of itself is admitting to failure, a failure towards oneself in parts, but also to the failure of one's ideal. Because the ideal and failure are often things that go together, and the medication is this basically this medical element that is going to prove that you need something. It's the proof by the biological that something has not worked out. Something of who the person is needs fixing. And this can be sometimes very difficult to swallow for someone that feels that they are above this, that they don't need it. In a way, it's going back to a position of vulnerability than to basically take that medication. And this is something that can make people very sad and anxious. And in a way, this is where psychotherapy can help, in this idea of lowering the ideal in order to get the medication that they need or that they want. And this is very different because in these cases, they don't necessarily feel that the medication will be complete success, but in the same time, they take the weight of the medication as it's going to fix me. In a way, they're afraid also of losing who they are to the medication. This is also another common fantasy, that medication will alter the personality so thoroughly that the person might not feel that they're themselves. And it might make them very afraid of basically of change and of changing who they are. Because this saying that I find very relevant, especially in this context, that the devil you know is better than the devil you don't. And in a way, they understand their suffering, they understand their pain, and taking the medication, because in their mind the medication is going to cure it, will change the rules of the game. And that's something that they are afraid of, and that they can basically feel that it's too much. And that's something that's very, very interesting. And what I'm saying here could also apply to psychotherapy, right? It's not just the medication, right? But it's interesting to see it in the form of the medication, because the medication is something that's very concrete, as it is something that's very practical. It's like a form of pills that you take or other variations. So therefore, it's literally a tool that can hold in your hand. And there's this very interesting perspective that when you take medication, there's a whole authority of medicine behind it, of pharmacology, that this thing is something that is palpable, both figuratively and literally, because palpable because it's going to have an effect, but also because you can hold it. It's something that is there physically, a form of presence, and that's something that's going to impact the body as well as the brain, and corollary to that, the mind. And very interestingly enough, there's another type of, but in this case, we're no longer be talking about fantasies, but there's a delusional aspect to the medication sometimes with psychotic patients. This idea that the medication can be something destructive, or that it's inherently evil, and that they have to take it because that people are expecting that of them, but they don't want to take it because they feel that there's bad in the something is bad in the medication, that the medication is there to control them, to basically not just change who they are, but to make them comply. I'm not saying, because you sometimes antipsychotics can be used for the patient to comply with the stuff. I'm not talking about those objective realities. I'm really talking about the subjective sin of they want to control me from the inside. They want to put nano machines in me. They want to basically make me act for them. They want to control me. They want me to be their puppet, and so on and so forth. Rather than real, but the real it can exist. The real mistreatment of people with medical drugs. I don't want to undermine it, or I don't want to say it doesn't exist. But here I'm focused on the inner subjective, and here in this case, the psychotic patient can be very, very, very afraid of basically losing all agency to the medical profession or to the mental health professionals. Therefore, this fear of being manipulated, being exploited, being used, being almost sometimes even harvested, as some people can even be afraid that organs will be taken out of them, or that the medication might alter their biology itself. And sometimes, very interestingly enough, psychotics might be very reluctant to take in medication not because, as we've said, there's this idea that it's weakness, or that basically they feel that it will be admitting to failure for them. It's not even worth it because they're not sick and they don't conceive of themselves as having any form of illness. In a way, this is what we call anosognosia, right? It's the fact that they don't recognize all the time that they have psychotic symptoms. Therefore, if you don't have any symptoms, why would you take medication? You're not sick. Therefore, it doesn't make sense to take anything. And often it's more when they realize that these psychotic adaptations are very painful for them, that those psychotic symptoms hurt them, that they start taking the medication, understanding that it's not that much about an illness in their minds, but about the suffering that they're experiencing, and that medication can alleviate part of the suffering. And this is, I think, the core fundamental of all these fantasies, is that the medication is, because it has the whole power of the medical field behind it, it's this idea that it will cure, it will heal. As, for example, when we're sick and we take antibiotics, it might heal us and might make us better. This is the same idea that can be true for the mental medication. However, it works very differently, as it's not about being cured, and patients know that. But they still have the fantasy that maybe it will give that. It will give them their life back, or that will be basically something that will be necessary and even opens up hope in, for example, the very depressive patient or the very anxious patient. And I think that that's something that's valuable. Of course, the video would not be complete without me telling you that there sometimes is a lot, for a lot of groups of medication, there's a lot of controversies and of side effects. I'm not going to talk about the side effects, as I said, I'm not a medical doctor. I'm trying to make this point very clear. But there's a lot of controversies, because you should know that all of medication relies on theory, and for those theories of the mind, it is not exactly full bulletproof, right? And is about, for example, antidepressants. There are a lot of controversies surrounding, for example, SSRIs. I'm not saying, and this is important, that they're ineffective or that it's bad to take them. I'm not getting into that. I'm just saying that there is some level of controversy. And often that controversy, if patients are aware of it, can create this deep fear that their brains might be damaged or hurt or destroyed. This is also a fantasy in which basically we depart from necessarily objectivity to go into a fantasy that, in a way, what can cure can also destroy. In a way, it sends us back to the idea of the pharmakon in ancient Greece, of the medicine is both what heals and the poison. And it's the dosage that varies. And it's a very interesting idea. And I think that often the medication in the minds of these patients that are aware of the controversies can be like the pharmakon. Yes, I might need it, but it might destroy me as well. Therefore, it's a very important, I think, him to explain to the medical doctor so he can alleviate or explain certain forms of symptoms, be it the secondary effects, the risks, and the effects. And of course, as a psychologist, I have a little bit, but very limited knowledge on all of this. And often I try myself to explain at least a theory that I have been taught about the medication. But unfortunately, because I don't have all the tools, I can't be as good of an explainer as a medical doctor, obviously, right? But I do try my best to try and talk about the medication, but also, and this is more important, more down my alley, try and investigate the analysis of what the medication means to the patient and what it represents both as a hope, as a fear, as a dread, or even if the patient believes in it. Because we never talk about this enough, but there is a question also of belief when someone takes a medication. That's a whole principle behind the placebo. And it is also something that is there with medication, classical medication. And that's something that is important also, that the patient is also having something hopeful or having some hope for the medication. And it's not a bad thing, right? None of those fantasies are inherently bad, and even the more psychotic end of the constructs are not necessarily inherently bad. They just, all of this needs to be talked about, I think, and deconstructed if needed to be deconstructed. Also, I should also add this because this is very important. Taking medication, except in very extreme cases, for example, of intense self-harm or in case of massive psychotic crises, is something of a choice. The person can choose. You always have the choice of taking or not taking the medication when you're not hospitalized. And that's something I think is very important to reassure that it's always the choice of the patient. That this is not inherently, how can I say, something that's prescribed but not mandatory. It's about how the patient basically feels that it can help them or not help them. And all the fantasies can basically make someone have a special choice towards medication, but it's not there to be the cutting off point. And I think that talking about these fantasies sometimes might help the patient to reach a conclusion and a decision in which they're less conflicted. I'm not saying that they get conflict free from that, but at least they better understand the nature of the conflict surrounding the drugs and the medication, obviously. So anyway, this is pretty much it for this discussion. Once again, take what I've said about the medical aspect with a grain of salt, all right? And if you have any questions or anything you would want to ask or anything you would like to say, please feel free to put them in the comments. I'll see you in the next one. Bye.